Yes.
So good morning, dear participants. I'm happy to be among you and present another subject. My domain of research is more like in social science and anthropology of health, which is different from education science. But it's linked to this science in terms of health education. So I would like to present you the subject, the main subject, health education for the uplift of health and school performance. The area of the study, health education curricula and its implementation for the enhancement of adolescents' health and diet quality. So this work was inspired after reading many literature, especially the international study on health education at an international level in schools and local communities. So let's talk about present the introduction. Our subject is focused on health education. It's to emphasize its influence for improving school performance in the long run during the stage of apprenticeship. It has been outlined in several studies across the globe how food behaviorism, lifestyle factors, poor quality nutriments can affect to a large extent intellectual performances or its deficiency in the stage of knowledge acquirements alongside health issues. So this has drawn serious concern to governments and health institutions like WHO, UNICEF, and European Union, US, and other states, especially Korea and Oman, to outpoint the impact of quality nutriments on childhood, adolescents' health and development, but also its influence on school performance. So I would like to emphasize about several notions: empowerment, lifestyle factors, health education, and school performance. So let's move on to the next, to the study. The objective is to deliver evidence through conducted scientific surveys on the effectiveness of diet on health conditions and school performance upon school students. What are the possible role of complementary alternative medicine on health education and for medical advice? Present transversal analysis and convene and respect various disciplines, health, science, education, medicine, and sociology of food consumption. So the method mainly was to give a record analysis of various recent research studies and surveys with selected literacy about nutrition and give a critical examination about food fabrics. So let's move about the approaches that I have used. It's a comprehensive approach to nutrition problems, the importance of diet surveillance, sociology of fast food concept, deliver an introspective critical review, medical and scientific health studies on quality nutrition, and ethical question about food consumption. So let's focus on patterns of eating habits. The influence of commercial food problematic issue of our study is about impoverished nutriments leads to disease, a major concern, and impact physical condition and school performance. The origin of fast food habits is an induced consumptional model. By this, I mean, it was through the hegemony of the fast food industry that led to a pattern of eating habits and behavior among adolescents, acquaintance to a pattern of eating habit, which created elementary behaviors. The danger of savory additives like the monosodium glutamate on children and students' health is a real public health concern at all levels. What are the repercussions of fast food on health and school performance? There are health risk factors, morbidity frequencies among younger individuals like obesity, diabetes, cardiovascular pathologies, which are really serious concerns. What are the reasons? That it's a lack of essential vitamins affects physical conditions and cognitive capacities. Then some scientific studies showed that the influence of poor quality nutriments would impact cognitive performance, i.e. memory, concentration, distillation, and the learning process. Needs of essential supply on minerals and vitamins, vital for the brain and growth process, like potassium, phosphorus, selenium, and B vitamins, calcium, and so on. Let's move to the other subject. What are the measures that has been taken to counter these pathologies? So we had nutritional plans in European started health campaigns and policies in schools. This was so after WHO recommendations and then states compliant to act. There were preventive measures over the last decades took place to introduce quality nutrition in schools at a national level, which includes school catering offer. The European Food and Nutrition Plan started from 2015 and 2020 to put into field the public health policy for preventable diet related to non-communicable diseases, obesity, and other pathologies. Also in France, we had PNS, a French nutrition plan since 2001 up to 2019, a public health nutritional policy to implement a national nutrition health program. So what we can understand about these plans and policies is these measures can also be viewed as a public leverage policy to redress eating habits and counter fast food trend. At the same level, at the same time, arise awareness on the value of qualitative diet and health preservation. What I would like to introduce also the notion of holistic view of the body, the human body, the comeback of TIBB concept, which is a complementary alternative medicine and its role in health education. It's also actually it's an ancient medicine, but it's coming back now and in several horizons of the world, notably South Africa, Asia, and Middle East, and a little bit in Europe. So it gives a comprehensive view of a human natural biological system, give awareness of lifestyle factors, originally a combination of Hippocrates' theory of the human biology and Avicenna's concept of scientific medicine. It's a holistic approach of the human body. So like you see, it's a Greco-Arabic medicine that's coming back now because it's to counter its scientific, rigid biomedicine tools, which is effective, but maybe not enough close to the human nature. We are talking about human nature. So this medicine, this alternative medicine, gives a good view of the human nature. We are talking about lifestyle and health promotion, which are there are six factors, all related to each other. Once they are all gathered, you can obtain equilibrium in health and increase your chances to counter diseases and illnesses and have a good condition, health conditions. As you can see, we have food, drink quality, movement quality, sleep and wakefulness, emotion, feelings, elimination. I'm talking about stress and all these things, emotion, stress, and elimination, and environmental conditions. So what is this, where it comes from? We are talking about uniqueness of individuals. Like Hippocrates says, it is more important to know what sort of a person has a disease than to know what sort of a disease a person has. Very interesting statement. It aims to identify the uniqueness of a temperament of each individual and indicates strength and weakness of each individual and predisposition to illness condition, anticipate health risks. What are temperament types? We have 4 temperament types on each of us, divided into dominant and subdominant combination. We have sanguineous, phlegmatic, melancholic, and bilious temperaments. So each of us has 2 dominant and subdominant temperament. What are these temperaments? To give a quick glimpse about this temperament, is that about personality traits and physical traits. So like in sanguineous, you have a sociable, extroverted person, while phlegmatic is more like introverted and calm person. Bilious person is more like a leader, outspoken, extroverted, and the melancholic personality is all natural temperaments, of course, are more analytical and introverted. This is about the traits, personality traits, but you have also physical traits. So what's the aim of these, to know and get knowledge about these temperaments, is to help have a better comprehension of one's natural temperaments, as each person is a combination, like I said, of 2 temperaments. For example, it can be detectable at an early age. For example, a bilious sanguineous combination will have a dominant quality of heat and would better follow a lifestyle that will decrease the heat level in drinks and food and conditions. Similarly, a phlegmatic and sanguineous temperament ought to follow a lifestyle that will decrease the level of moistness in drinks and foods and conditions. Taking into account these factors would give a personal comprehension of one's own needs and adequate diet. Let's move on to the next subject. So I conducted several, I've selected few literacy scientific surveys to have some evidence, scientific evidence about the effect of food on individuals for regarding school performance. So a recent observational study concluded that the regular consumption of frequent intake of fruits, vegetables, milk, and regular meals, especially breakfast with quality minerals intake, contributed to high levels of school performance to varying degrees. Conversely, any frequency of soft drink, instant meals, fast food intake, and eating confections 7 times a week negatively affected school performance. These relations between dietary habits and school performance were maintained after considering relationship between personal, socioeconomic, and dietary variables. So this interesting study was conducted at a national level in Korea, for example, in more than 300 schools with enormous data that gave evidence about food impact on school performance. So in this scientific study, they have there is a structural relation of different influences that affect diet and school performance. We have various social and diet type variables. At the left, you can see the personal factors, age, also to think to concern the individual. And on the bottom, you have socioeconomic variables, region, the region of the person, and economic status, education of parents, etc. And on the top, you can see type of diet, whether fast food or natural diet, fruit and breakfast, all related to diet factors which impact school performance. So this gives you a quite complicated view, but it's simplified the interaction between different variables that impact school performance. Like we said, seen in 6 life factors, it joins a little bit this theory. So also, to give a let's have a look at the simplified interrelated significant variables with school performance. Like I said, in the structural review we have seen socio-demographic variables, school performance, and lifestyle factors. What are the guidelines of health education? Is to sustain health conditions, individual empowerment, give individual empowerment, awareness on diet and health issues to implement among pupils, which means in the school curricula can be introduced to transmit knowledge on diet and health issues. Also, healthy lifestyle quality choices for different temperaments. Also implement some knowledge about regular exercise, regular well-imparted meals also, insist on these things, and ban processed food as much as possible. So TIBB management for maintaining health, help to emphasize on appropriate lifestyle factors, health nutriments, good sleep, exercise, convenient emotional and living environment, and also good cultural food habit. Each country has its own cultural type of food, which necessarily can be very beneficial or not beneficial. So taking this into account can positively participate a good supply and quality nutrients if rich in minerals and vitamins for the body and cognitive needs, or impair them if too rich in sugar or processed food in the long run. So to finally, let's have a talk about discussion about this subject. So the discussion is the prevalence of health risk factors due to poor diet among children and social public impact. To which extent health education can be effective in regards to health risk. The main interest is to prevent factors of recurrent morbidities to occur among school children and students beforehand. These recurrent morbidities, obesity, diabetes, and deficiency in minerals, high cholesterol, decrease of cognitive capacities that would impact young individuals, family, and create serious public concern. It's also worldwide concern in the 4 part of recurrent chronic diseases that appeared in the past years. To finally conclude, we can say that the knowledge of our individual inner system and qualitative nutriments will help give awareness and empower pupils and adults to manage their health effectively. This could be so through a school curriculum on health education. Teachers can be involved, communities can be involved, parents can be involved to help better understanding and awareness and give empowerment to families and children to manage their health, which is a very important factor for success and school performance. So integrative medicine concept could be a pedagogical tool in giving a comprehensive view on lifestyle factors, health and illness management. This integrative medicine is introduced in Oman, for example, and some Gulf countries, and maybe also in Pakistan and India is quite implemented. The notion of morality approach in food and consumption can be an integrative principle in health education to help modify eating pattern, which is very important concern, and behavior pattern. Health education can take into account temperaments, human balances, which we are talking about natural qualities of humors, heat, cold, dry, and moistness, which will enable reaching well-being and prevent health risk through the health education curriculum, which will help raise awareness and empowerment, like I said, to school students, while associate teachers and parents in health issues and management. All these are meant as preventive methods and measures for sustaining health to counter possible disease due to impoverished diet and poor conditions. So I thank you for listening, and if there are any questions, I'll be glad to answer.